For your great tea up session. Okay, I'm very delighted that this is your first time. Are you sure? I think you have done many, many times overseas already. Okay, so how's everybody feeling right now? Good. Yeah, I'm feeling good too. Yeah, I've just got my last 2 Elfahex and my stock is not here yet. Okay, so tonight I'll be sharing with you on this amazing product called the Elfahex MIME. Okay, if your friends hasn't come in yet, I think you should just give them a buzz because I've got a lot of very good testimonial. So if you're going to miss out tonight, then I don't know when will be the next time that I'm going to share again. Okay, so let me share my screen. Okay, Naomi-chan, can you see?
Yes, yes.
Thank you very much. Okay, so wait, hang on. Okay, so this is the product that I'm going to share tonight. Elfahex, your body powerful immune modulator. So what is immune modulator? It's a super big word to use, right? I think for a layman, okay, because we don't usually use this kind of immune modulator in our daily lifestyle. Okay, not forgetting, I'm going to thank 3 sets of people that has along my journey here in Elken that make it so successful, so meaningful, and so wonderful, and so much of excitement that I have. Okay, they are none other than DCM Popupui from Cameron Highland, MCCM Chu Haoling Kuteki from Kelantan, and not forgetting PCM Mr. Singh and Mr. Singh from KL itself. All right, so everybody, do you know your body well? If you know your body well, just type in anything you want to type. Well, not so well, totally you don't know. Okay, let me see some response. So when you give me response, I'm able to share even better. Okay, so in Elken itself, we are so fortunate that we have got this concept called the molecular reform therapy. I guess there is a lot of mummies here that is listening to my talk. Okay, for the ladies, for the mummies, we get pregnant, right? So when we get pregnant, we have got the fetus, right? We started all with the eggs and the sperm joined together. And then after that, you have a wonderful time. And then that is where the fetus comes. Okay, so when a fetus comes, the fetus will slowly develop, okay, into a big baby. Okay, and after that, you deliver the baby. So in our body itself, it's the same. Okay, we have got the cells to the tissue, tissue to the organs, organs to the system, and from the system, we go to the body. So it's very interesting, right? It's just like a defense system like that, a mechanism. Okay, so let's start off with the cells. Okay, from the cells itself, we have got the right and the left. Okay, it's just like our body, we have got the right and the left. Okay, we have got 2 breasts, we have got the right lung, the left lung. Okay, we've got your heart on the left, okay, and so on and so forth, your 2 kidneys. Okay, so cells has got the left and the right. Okay, so looking at the screen itself, on the right is the nutrients and on the left is the toxin. So let's go for the bad one first. Okay, so we have got the toxin. From the toxin itself, we have got 6 factors that lead to unhealthy cells. The unhealthy cells is something that all of us do not want it to happen in our body. Okay, how? As I've said about the fetus earlier on. Okay, I think some of us here, we have got friends that when the mommy get pregnant, the babies doesn't develop well. Okay, it all boils down on a lot of reasons why the fetus does not develop well. Same goes as our cells. Okay, if your cells, if you have imbalanced diet, very bad air pollution, water pollution, every day we got stress. Okay, I think here nobody has no stress. Even my son is listening, he also got stress for a 12 years old boy. Okay, lack of exercises. Yes, many of us are lack of exercises. Why? Just very simple, plain lazy. Okay, plain lazy. okay? And those that has got health problem, you are excusable. Those has got no health problem, you are not excusable. And it leads on to unhealthy lifestyle. Okay, unhealthy lifestyle has got many, many, many kinds. Okay, it can voice down to sleepless in Singapore, sleepless in Malaysia, sleepless in Thailand, you know, the sleep part. Because why everybody is chasing time. So you and me, all of us has got 24 hours only. We got not more and not less. So when you want to chase something, okay, you chase time and you forgot that you need to sleep. So that is where your body breaks down. Okay, you go smoking, you go drinking, and so on and so forth. Okay, and after which all this, it will give you diseases, lots and lots and lots of diseases that you can think of. Okay, so now from the back one, let's push the back one away and we bring in the new, the good ones, that is nutrients. 4 types of MRT steps that we have from MRT, Elken MRT itself. Okay, we have got the balanced nutrition, meaning you take balanced nutrition, meaning you have got your food, your fruits, your vegetables, your fish, okay, something that you call balance, because everybody's here, our balanced nutrition all are different, okay? And then we have got the increase of oxygen intake, okay? We got different kind of product that we have. We also need to detoxify our colon, which is very, very important. Okay, if you don't detox your colon, everything will get stuck inside and you will get a lot of small little pockets everywhere in your colon. Okay, and that is where constipation will set in. All right, and last but not least, you should have your health regulation, meaning you should know how to de-stress, you should know how to exercise, you should know how to have enough of sleep, and so on and so forth. So if you were to have all this, your tissue, your organs, your system, your body will be very healthy and it will give you good health. Okay? Whoops. Okay. What do we need? Immune system. Our body needs immune system to protect from various bacteria, various viruses, parasites. You think of, you name it, you must have the immune system to protect them from invading into your body. Okay, well-modulated immune system is equal to the key to your good health. Okay, just imagine you have got an imbalanced immune system. What will it lead to? Okay, it may lead you to a lot of unwanted chain reaction. Right, this is one of them. Allergies. Okay, overreactive allergies. Okay, just like myself, I do have a lot of allergies. I've got food allergies. I've got drug allergies. Okay, and thank God that today I am considered very good after going through the MRT concept. Okay, so allergies can be sinusitis, whereby early in the morning when you wake up, you start sneezing. That is called one of the allergies. Conjunctivitis is where red eyes, sore eyes, okay? And you get eczema, all right? During this pandemic, the eczema rate has gone up fairly high, okay? And the next one, we have asthma. We have got cough, flu, runny nose, and we got hay fever. Okay, hay fever are not that commonly nowadays. Okay, and as well as we got the external agent, meaning you have got your soap, your detergent, the peanuts, okay, and so on and so forth. Okay, let's come to allergy 1. Okay, these are external agent. Okay, there's 235 million of people that are suffering from asthma every year, which I believe, okay, this asthma at times it can carry in your body till a certain age. Okay, maybe when you reach 35, 40, it will just resolve by itself. Okay, some people know, some people will still keep carrying on. Okay, they can also come at the late age, okay, for asthma. Right, next one is your autoimmune. This is the internal factor. okay, autoimmune, we got the RA, the arthritis, rheumatoid arthritis, whereby you can see your fingers, you know, in a very, very weird kind of a position. Maybe now you want to have a look at your fingers in case, you know, you don't know whether you got RA or not. Okay, sometimes you get all your joints pain and then it becomes crooked. Okay, that's RA. Okay, you will have colitis, that is the inflammation of your intestines. Okay, this is also in a rise for people that always drink liquor. Okay, whenever they drink a lot of liquor, heavy liquor, brandy, hard liquor basically. Okay, and next one you have the lupus. Okay, the lupus, the SLE lupus. SLE lupus is something that it can be very serious, and it also can cause death too if you really don't look after it, and it will also dysfunction your kidney too. Okay, next one we have got your type 1 diabetes. Okay, type 1 diabetes, and you have got your psoriasis. All right, okay, next one. Okay, you will have autoimmune diseases, as I said just now earlier on. In Malaysia itself, is 1 in 20 adults, okay, between the age of 25 to 50 suffer from RA, rheumatoid arthritis. So please be careful of that. And infection sets in, this is the external agent, okay? So the viruses from the outside invaded into your body. When if your immune systems are imbalanced, okay, you can easily capture the viruses into your body itself. You can get flu, you can get cough, flu, running nose, hand, foot, and mouth diseases, hepatitis B, okay, you can have dengue, which is on the rise, okay? Many people very, very conscious about COVID-19, but everybody forgets about dengue, and not forgetting the mosquitoes are everywhere. Okay, and mosquitoes are everywhere. And then we have got the skin infection too. And not forgetting C19. Okay, still the external agent, we have got the infection rate. There are more people affected with dengue, as I said earlier on just now. In my area here in Singapore, we are very lucky because we have got banners, okay? If my area here has got people that contacted with dengue, okay, they will have banners coming up to tell you it's a yellow zone, okay? So when you see this yellow zone banner, you know that my area here has got people contacted with dengue. And after which, they will change the banner color to the green color, okay? Meaning the level has gone down. So this is something very good to alert everybody that, you know, the place that you stay, whether is it dengue prone or not. If it's dengue prone and you know yourself is low immune system carrier, then you have to be very super careful over it. All right, people that has got tumors, cancer, okay, lung cancer, colon cancer, breast cancer, any cancer that you can think of, they are also considered somebody that has got very low immune system. So now, everybody also produces 10,000 cancer cells, okay? Everyone here that you are listening to my talk, we all has got cancer cells in our body. Okay, when is the cancer cells going to bloom? You and me, we do not know. So better take precaution right now. Whoops. Okay, so one person is diagnosed with cancer every 4 seconds. See, I speak how many seconds already? So many people already got cancer already. Newly diagnosed. Okay, for the men is 1 to 2 and the women is 1 to 3. Okay, cancer is something that it can be quite scary. Okay, in my family itself, I've got 3 persons. Okay, I've got 3 persons. I've got my father, my brother first has got nose cancer. Okay, it's a very, very so-called very rare kind of a cancer cells that attack him, and he gone for one surgery. He can go into the operating theater for 23 hours. Okay, so just imagine they take his muscles from the leg, and because nose cancer, they don't go into open here. Okay, they don't go into the nose to open. They goes into the neck. Okay, they will open from the neck and then it goes into the nose to get rid of the cancer cells. So you just imagine this part here is open and the doctor has got to take the leg muscles to repair, to put it here so that he can move. Got to take the buttock skin to patch here so that they can cover it. Okay, and then another operation that he goes for is the same. It's over at this side, and this time round they take the stomach muscle to paste it, to put it inside here, and they take the thigh skin to put it in, to flap it over. So all in all, 2 operations per operation is about 23 hours. Okay, so you can imagine how intense it is to do an operation for a cancer patient. And come down will be my father. My father has got cancer from the lungs to the spine and to the brain. Okay, so father itself is quite fast. He has cancer since 74 years old. He fought for 3 years to see my son grow, and after which 1 month the cancer cells goes to the brain, and that is where he left the world. Okay, so next will be my sister. My sister has got breast cancer, also mastectomy done, and after 1 year she has another cancer, which is she has the nose cancer first, and then after that 1 year later she has the breast cancer. So you can see a person need not have to be so-called link cancer. You can have different episodes of cancer because our body has got cancer cells. So it's good to take precaution. There is a need to balance our system, okay? And this is said by the Nobel Prize winner, Dr. Neil, okay? This is what he said, there is a need to balance the immune system. Okay, let me introduce you this wonderful product called Elfahex, okay? Powerful immune modulator. Why so unique about this Elfahex? Because it's very special patented ingredient, okay, MIME, mycelium immunomodulator extract, okay, developed through research with Tokyo University, okay, with research Tokyo University. And the special patented ingredient is extract from polysaccharides from the selected super mushroom, mycelium of Basidiomycota. Okay, it actually from the root of the mushroom itself. It's the shiitake mushroom, okay, from the root itself. So you see, we are so lucky that we can get to eat the shiitake mushroom, and now the root itself is not made into, really made into good use with, okay, acylyated, they have got acylyated alpha glucan inside there. Okay, so you see there is so many mushrooms. Do you know that, as I told you, I've got a lot of allergies. Last time, I cannot take any mushrooms at all. No way. If I were to take mushrooms, my eyes will get swollen. So whenever I go dinner with my friends, they all know, okay, cannot order mushroom. She cannot eat mushroom, so no mushrooms at all. Okay, thank goodness, thank the Lord that today I can eat mushrooms because of taking MRT product and also because of Elfahex that helps me a lot. Okay, so it tested hundreds of subspecies medicinal mushrooms to identify the highest potency in polysaccharides. Okay, so you can see all kinds of mushroom there. Actually, mushroom tastes very nice. Okay, so we have got a patent on manufacturing process and quality. Cultivation process have been awarded, US patent on, also on papers. Okay, and this is the way that they do, okay, how they do the mycelium itself. From the root, then they go to culture it, they go to shaking, they go to all kinds of processes to give us small little black color soft gel, which is very easy to swallow. It's just like an M&M kind. Okay, they also has got routine DNA pattern testing too to verify the MIME identity. Okay, it is called the super mushrooms. Okay, so now we've got two kinds. One is the Elfahex and one is the polysaccharide product mushrooms in the market itself. So I believe you have heard of people telling you, yes, I take mushrooms. I go to the pharmacy to buy. I go to the Chinese Singlish shop to buy. Okay, but not knowingly what are the ingredients inside there that they have. Okay, for the molecular weight will be 5,000 deltoid, okay, equals to 100,000 deltoid beta glucan. Okay, so it's like one big watermelon like that. The absorption for Elfahex is superior. Okay, the absorption is superior, very good in absorption, whereas the other one is very low in absorption. Okay, and it also helps in increasing our NK cells. Okay, actually our body has got a lot of cells. There are different kind of cells inside there. So it also has been studied by more than 100 universities worldwide. We are so honored, you know, to have this small little black color, you know, soft gel that so many universities worldwide, they are actually having the study of it. Okay, include Harvard University, Columbia, Texas, Hokkaido University. We have got the Russia, the Thailand, the Philippines, the China. Wow, so many, huh? Okay. Right, there's a lot of clinical studies, more than 400 clinical studies that MIME and asthma patients, okay, it recover 48% in 8 weeks. Okay, we have got MIME with the colitis patient, the pro-inflammatory cytokines up to 80%, it reduces it. Huh? Okay, we have got the MIME and the influenza. Okay, it helps to improve our immune response to viral infection, such as influenza. Huh? Okay, we have got MIME to cancer survival rate. So you can see from this chart here, okay, stage 1, stage 0, stage 2, stage 3, okay, after taking the MIME itself, the survival rates are very high, okay, almost 100% improve, okay. Right, this is very interesting. Okay, if you have not taken your dinner, it's fine to see. If you have taken your dinner, hold on to it. Huh? Okay, so these are the 400 clinical studies that they have done for tumors. They uses the rat. The rat has got tumors too. So they uses MIME, okay, together with chemotherapy itself. And you can see the tumor reduction very well. This can see from the last graph, okay, right at the bottom. Okay, we've got more clinical studies. Right, this is very interesting. Okay, if I were to be in Singapore, maybe I get to go, but I was not here. So since 1992, over 400 researchers, doctors, and professionals gathered in Japan for an international symposium on the latest studies and research of MIME. Okay, you see, our products are so high class, A class. We even have got a symposium on our product. How wonderful it is. Okay, it also uses more than 700 hospitals and clinics worldwide too. We have got a lot of certificate. Okay, we have got the HACCP, ISO 9002, the M, and we are also certified halal. So our Malay friends, you can start sharing to all your friends out there to take MIME Elfahex. Okay, a powerful immune balancer. a must-have immune modulator food in the modern life. Yes, I totally agree with this. Okay. It's actually, you can say that it should be one of our table food also. Just like spirulina, you know, is one of the table food. So is Elfahex. Okay. Right. So what is the benefit? Okay, it helps to reduce your allergies. It helps to reduce autoimmune diseases, helps to reduce infection and assist in faster recovery. It also helps to prevent cancer. Yes, the fourth one I love the most is the fourth one. Okay, because we cannot afford to have these diseases. Okay, this is something that is very scary. How you can take MIME Elfahex? You can take one soft gel 2 times daily. Okay, it must be taken before your meal. Okay, take before your meal. And then if you want to take for certain purposes, okay, you can titrate yourself. You can tilt down the dosage yourself. So if it is a cancer patient, for me, I'm actually treating a few of my customers who are having cancer of the colon, cancer of the sigmoid, cancer of lymphoma of the lymph node. Okay, I've advised them to take is 8 soft gel per day, 4 morning and 4 night. Okay, this must go all the way at least for 6 months. Okay, why? Because we don't want the cancer cells to mutate again and again. Okay, so after the 6 months, you should have another CT scan done, and we'll see from the CT scan result what does it shows. Okay, if the CT scan result shows it has been improved, then you can titrate down. If the CT scan shows no improvement yet, because different body functions differently, immune system will absorb differently also. So then maybe you want to carry on the 8 soft gel per day again. And then from there, I will see what's the result is like, and we will move on from there, and we will tilt down from the dosage itself.